Hello everyone, welcome to Hillsoft Health Tech. My name is Dr. Ezadiche Emmanuel Chinedu, and I will be your instructor for today's video, titled Body Planes in Veterinary Anatomy. Now, body planes are imaginary lines that divide the body into different sections. Now, these lines are not visible to the ordinary human eyes, but then they help to what? To demarcate the body into different sections that enable veterinarians to be able to what? Identify key structures. Now, these body planes, okay, they are very important because they help anatomists to describe the location of structures accurately. And veterinary medicine is about what? Animal health. And you cannot be second guessing. You cannot be seen making mistakes. So these body planes are very, very important in what? Helping us to what? To locate the important areas of the body. And I'm going to be teaching you everything you need to know about body planes. So stay tuned. Why understanding body planes is essential in veterinary practice? Now, over the years now, so many veterinary doctors have been seen practicing, and because of how vast we are in handling both different species of animals, that's talking about the large animals, the small animals, talking from rats, from rabbits, goats, sheep, cattle, you see that all these animals are all having almost similar anatomical structures. And as a veterinarian, your knowledge of body planes is key because you need them to be able to what? To perform physical examination on most of these animals. To be able to what? Systematically examine the animal from head to what? To the tail. Now, the body is divided into different regions. You have the head region, the neck region, the thoracic region, the abdominal region, the pelvic region. And you also have the forelimb and the what? The hind limb. Now, without a proper knowledge of body planes, you as a veterinarian or you as a veterinary anatomist will find it difficult in what? Examining most of these structures. Let's say you're looking for a lump on the head region. You won't be able to know where to look if you don't know your body planes well. Or let's say you are trying to what? To take the what? You're trying to use your stethoscope to hear the long sound. If the animal, let's say a goat for instance, is having crackles or rails, you understand, abnormal long sound, your knowledge of veterinary anatomy will guide you to know which part of the ribs to place your stethoscope on so that you can hear this sound very well. You understand? So body planes helps you what? Systematically examine the animal from head to tail. And it helps you accurately locate swellings, wound, or pain. Now the animal could be feeling pain. You may not know where, but immediately you see the animal walking from afar, you see the way the animal is limping, you could tell where the animal is feeling what? This pain. And also, body planes, when you use the correct directional terms, such as cranial, caudal, dorsal, ventral, medial, lateral, proximal, and distal, which I'm going to be explaining to you the various meaning of these words I just listed. If you use them correctly, is going to what? Improve your what? Your veterinary anatomical skill. Now you see, body planes is very essential in physical examination. For example, swelling on the lateral aspect of the distal forelimb. Now, when it says that there's a swelling on the lateral, now when you hear lateral, it's trying to tell you now that it's away from the median plane. So, is it swelling on the lateral aspect of the distal forelimb. So let's understand this now. Lateral aspect away from the what? For the median plane. So that means we are looking at our what? At our forelimb. Now, it's at the lateral aspect, which is what? This region here. And it says what? The distal forelimb. So that means it's at the what? The leg, the palm region. Let me open the structure. Yes, let's use the. It says swelling on the what? The lateral aspect of the what? Of the distal forelimb. Now, this is the distal aspect of the forelimb. So the swelling is on this lateral aspect. Okay? Because when you hear the word lateral, lateral means away from the what? The median plane. It's moving away from the median plane. Now, all this would not make sense if I don't define the word median plane. Now, I will go into it properly, but I need you to understand why we are what? We are studying body planes and why it's essential. Now, two, diagnostic imaging. Now, body planes are very good because they help to what? To position the animal on the right place while taking a radiograph. Why using an ultrasound on the animal or running a CT scan or a MRI, that's magnetic resonance. You have to what? Have proper understanding of body planes to be able to place this animal well so that that particular abnormal enlargement you are observing on the animal's body, you could place it at the right part to get your radiograph properly. Now let's say the animal is having hepatomegaly, and you want to use the ultrasound to take the width and the height of the liver to check it with the normal and the abnormal to see, is this liver enlarged? Is there actually hepatomegaly? You understand? If you don't have a proper knowledge of body planes, you will not be able to position the animal on the right place to get the accurate image you need. And also interpreting images in standard planes. Now, like I said, I've not yet mentioned the types of body planes that we have. We have the median plane, we have the sagittal plane, we have the dorsal plane, and we have the transverse plane. And if you don't have a good knowledge of body plane, you will not be able to identify all these. You won't be able to identify them. And remember, animals are what? Are quadruped animals. They stand on four legs. They don't stand on two. So your knowledge on body plane is very important, not just only for physical examination, but for also diagnostic imaging. And also in diagnostic imaging, localizing lesions precisely. That's pinpointing the exact location that lesion is found. Let's say there's a growth, there's a tumor, and you are trying to remove the tumor. If you don't know your body planes very well, you may just end up cutting up the animal anyhow. And this is not why we practice veterinary medicine. We practice veterinary medicine for accuracy because animal life is very precious. Helps determine if a mass is cranial or caudal to another organ. This animal, okay, and we all know that the heart is located on the left side, okay. This other side is the right side, while this side is the left side. Now, if let's say we identify that there is a mass around the heart, let's say there's a mass around the heart, and you're trying to explain where that mass is located, and let's say the mass is found around the aorta, that mass is actually cranially located because it's towards the head region. You understand? So you see how important, because you may make a mistake and say the mass that you found is caudally located, which is whenever you are talking about caudal, you are saying towards the tail region. And that mass is not caudally located. Now you end up making the veterinary surgeon open up the animal at the wrong place. Precise accuracy. This is why you should know your body planes. I'm just listing out the reasons why you should know your body planes. In the next video, I'm going to educate you properly on what body planes are, the different types, and also the associated planes along the line. The third reason why understanding body planes is essential in veterinary practice is because during surgical procedures, body planes help you plan surgical approaches. Now, let's say you want to perform a cesarean section in a goat, and you know that the rumen is located on the On the left side. And you are trying to open up the animal, and you don't want to make a mistake. While opening up that animal, you end up cutting the rumen open mistakenly, exposing the abdominal cavity to the numerous amount of bacteria in the rumen. And is on the left side. Maybe I will go through the right abdominal flank, make your L block, local anesthetic, and then you incise and open up through the right hand side, the right abdominal flank, and you're good to go. You understand? Though there are some persons who will want to open through the left because they believe if they open through the left, after removing the rumen, they are already into the The uterus. You understand? So, with your knowledge of body planes, it helps you plan your surgery effectively, and you end up not. It helps you to understand where to make incision. Now, since we already know that want to perform a cesarean section, it is flank. Now, if you don't know the abdominal flank, okay, the abdominal flank, which is at the pelvic region, closer to the thigh. So your body planes helps you understand key anatomical structure, and it helps you also to navigate deeper structures with confidence. This is here. Now, let's say you are trying to give infusion to an animal. With your body planes, you already know where the cephalic vein runs through, that it runs through the humerus. It runs through the coronal region. And immediately you apply pressure and you go in with your scalp vein. But if you don't have good knowledge of your body planes, okay? Also, anatomical descriptions. Now, this is the fourth reason why understanding your body planes is essential. It helps you hands, muscles, and structures. Having a clear communication in the textbook, lectures, and clinical discussion. So if they are saying, this is cranially located, this is dorsally located, you will not be confused because you already know what this is. If they say it's dorsally located, that means it's at the bottom, the lower area, the abdominal region. If they say it's caudally located, that means it's towards the tail. So you see, without proper knowledge of your body planes, your descriptive term, and the body cavity, you as a veterinarian will basically find it difficult to understand anatomy. That is why I'm spending this time. And on our next video, I'm going to be diving deep into the major anatomical planes that we have. So seeing you on our next video. Goodbye.